Hello and welcome back to All Therapists Are Jerks with Ulland
and Jo.
In this episode, we'll be talking about validation and the powers of validation.
That sounded good. The powers of validation.
It's a very powerful thing.
It is.
So validation tends to land quite squarely on the acceptance side of the acceptance change dialect within DBT. Also more towards the acceptance side would also be mindfulness, distress tolerance, and they tend to be considered more of like humanist type therapy or more connected with the other person. Change strategies have a lot to do with problem solving, would be kind of the opposite to validation. Emotion regulation, interpersonal effectiveness tend to be more change strategies as well, and we tend to think of like behaviorism or behaviorist as change-based strategies.
Right, and as we've been talking about in other episodes, we've been talking about how acceptance is necessary for change, and in order to effectively validate people, you can actually help them move toward acceptance, which then helps them move toward change. Mm-hmm. A lot of what people experience kind of historically through, in all environments, but probably the residents that we work with, they have a lived history of a lot of pervasive invalidation, and being able to have a good, solid validation really helps them move out of some of the suffering that they experience, or at least letting them know how their suffering kind of makes sense.
Right. And it's really important, too, because we talk about in the biosocial theory, to stay regulated, one of the things that you actually need is validation, and that has to either come from yourself or from your environment. So learning how to validate oneself becomes very important for regulation, and partly because you can't always rely on your environment to validate you either.
Exactly. So validation communicates to another person kind of that their feelings and their thoughts and their actions make sense and are understandable in a particular situation. So it doesn't necessarily mean that in every situation these behaviors would make sense or their thoughts would make sense, but what you're really taking into account is the person's lived experience. Like, it couldn't really be any other way. Mm-hmm. You can validate that even if you kind of don't agree. And we show acceptance or understanding of how another person sees a situation, even when we don't agree with it.
Right.
And I think that that's really important too. And, I think that comes a lot from the Zen philosophy part of DBT. Mm-hmm. And then validation lowers emotional intensity of a person when we're interacting with them. It increases the chance that he or she will remain in the conversation. I think that's a really important piece too, especially when we're trying to do conflict resolution. Oftentimes, we try to help people understand that I almost call it like a validation Oreo cookie.
Right.
So like validate, like, okay, it makes sense that this is going on and this is a change I'd like to see, and I'm going to validate you again. So I kind of sandwich my change request in the middle of two validations.
Right.
Which helps the person stay there and not get defensive.
True, it's very helpful. The other part I think about with validations, I actually, as a psychiatrist, I do view it as a biological treatment. Mm-hmm. So I know that might sound like a weird thing to say. However, one of the benefits of validation is that it lowers physiological intensity. So when people are dysregulating, often their sympathetic nervous system's increasing and they have a higher tone, so they might be breathing a bit faster, they might have a higher heart rate, higher blood pressure, and so they're getting physiologically activated. But when validation is well delivered, it actually lowers that intensity. It actually does it faster than like Valium or any other medication actually, is that if you time and place a validation really well, that the other person's calmer. And to me, that's extremely important, and that's why using validation or getting good at validation as a tool is ultimately quite important.
Right. Can you tell your story? The story from when you were in your, I think when you're starting your psychiatry rounds?
Yeah.
I love this story.
Oh, I had like the worst. Everybody says that, like, and then they always say like, oh, it's never like this. You know what I mean? Like, I like that one too, when you show up as like a total shit show and people are like, oh, it's never like this. But then you're like, it's kind of like this all the time.
Exactly.
But
that's not validating.
Yeah. So I was fortunate to be at Dartmouth, which is a place I had picked to go to do general training, which I enjoyed. And it has a tendency towards being steeped in a little bit of psychodynamic tradition, which I also enjoyed in doing therapy. But I remember the first day actually walking onto the psych unit as an psych unit, just being new. And we walk on the unit, and there's a guy sitting in a chair who's currently having a myocardial infarction. So I'm like, I'm on a psych unit. Why is that a thing?
AKA heart attack, for those of you who are not geeks.
Using fancy words over here. So there was that, and I was like, oh, that was a big deal. And then like later in the afternoon, there's another lady who had an eating disorder, and she had actually snuck potassium onto the unit and overdosed on potassium. So I was like, oh my God, like this is crazy. And there's a lot of like intense emotion on the unit. And I was like, I don't know if I can do this because I'm kind of a bit of a mellow person. I was like, this is super intense. And I hadn't been on a psych unit that was that intense. And it was one of those unusual, like, this is like a weird day.
Was it a full moon?
No. Well, I actually don't know, but statistically speaking, probably not.
It's another conversation for another day.
No, it's probably just joking around. People from like the Northeast Kingdom of Vermont, maybe that's what it was.
No.
That's their joke. Oh, it's a different world up there. So later in that afternoon, there was a patient there who we got to know relatively well, who was kind of was well known as having borderline personality disorder and just an extensive history of trauma. Her life was just trauma after trauma, and you really felt for this woman. And she had a very difficult time regulating emotion. And we were sitting talking with the chief resident, Duke, which is such a great name. So Duke was visiting with us and kind of giving us the lay of the land. And all of a sudden we heard the screaming outside the staff room. And so it sounded like a woman had just like completely lost it. And so Duke says to us, he's like, here, watch this. So we follow him out of the room and come around the corner, and there's this lady who is just standing across, kind of this higher nurse stations, screaming at the staff, just yelling. And the nurses are very like doing their best at being very calm with a very understanding voice, but not really moving, giving her lots of eye contact. But it kind of felt weird, like overly calm, and she had just lost it.
So their intensity isn't matching her intensity.
Right, which is invalidating.
It's completely invalidating.
So they inadvertently
I'm having a really urgent issue here, and y'all are calm.
Yeah, do you not hear me?
Yeah, Are you not human?
Yeah, so she lost it, and I think it was something actually really minimal over like wanting to place a phone call, but it wasn't phone time. And it's just like, she's a 40-some-year-old woman. Why does that have to be the limit, I guess? But it was interesting because Duke kind of watched, kind of saw what was going on, and then he kind of said her name. She looked at him, like daggers, and he's like, you are really pissed off. And then she looks at him, she kind of stops. She's like, well, yeah, I am. And then he's like, well, let's talk about it. And he just like kind of let's talk about it and moved his body to kind of, and he just started walking over, purely confident, we're going to walk over here and have a conversation about it. And she did. She just broke the connection with her anger with the nurses and just followed Duke over the corner and had this conversation where she was at like immediately half of the intensity of anger she had before. Within 15 seconds, just dialed right down to the point where we find out it was really about a phone call. And then, he, at the risk of other staff saying he was splitting, obviously gave her the opportunity to make the phone call because it really wasn't a limit that was worth holding at that point.
Well, and at that point, too, you're trying to reinforce her actually being effective.
Oh,
So she was able to regulate, asserted what she wanted or needed, and you're actually then reinforcing being effective versus giving in when she's screaming at you.
Right, just Duke just saying, you're pissed off, like, and then emoting that to her, like, that's really what she needed, like, yes, I am, no one's hearing me, you're hearing me, and so now I can have a conversation with you.
Well, do you think about, like, times in your own personal life where you have felt unseen and unheard? It is a really intense emotional experience to feel unseen, unheard, unappreciated, unknown.
Right.
I think that's one of the things that we seek in life is to feel connected and to feel seen and heard and validated for who you are. I think, in general, society tries to shape us, into these effective human beings with a lot of missing pieces of, being able to be known is hard.
Right. And so if we look at trying to define validation, I think of validation as what's valid or what's true or what's correct in a sense. And what we're trying to do is, like we talked about before, is acknowledging a person's experience. Every human that basically I would say who's not on the spectrum, we all have a need to express how we feel and be accepted for how we feel at the same time. So I can be me and have my experience and still be accepted by the people around me.
Right. And when we're doing that, we want to be communicating that a person's perspective makes sense. So even if we don't agree with what they're saying, we can agree that their perspective makes sense, which actually requires us to be able to communicate empathy. And empathy, of course, is understanding of another person's experience. Though we can't fully ever really understand someone else's experience,
right,
we can see things from their perspective, which I think is really helpful because, well, a lot of times when you get into arguments, you get into like who's right. You want to be right rather than connected. And if people just paused a little bit every now and again to say like, okay, how does it make sense given your lived experience, you feel the way you do, it probably would diffuse a lot of arguments.
Right. I think that's true. And it's not only just like understanding a person's perspective, you have to communicate back to the person also that you understand their perspective, which is really what validation is.
Or even if you're trying to understand their perspective. I think sometimes, even if we can't understand someone's perspective, the effort of trying to understand their perspective is validating.
Yes, I think that is very true. And then validation also kind of has two components. One is the explicit verbal things you say or the content of what you're saying, the words that you use. The other part is a lot of times nonverbal, which is more implicit or functional. So how your body posture is, or what your eye contact is like, what's the inflection in your voice. So it's kind of that felt, like feeling like someone really gets you. Not that they say they do in a very cognitive understanding like way, but more like they're with you in that moment. And again, and Joe had said before in previous podcasts that nonverbal communication is about 80% of all of our communication. That's like the most important part, is getting our nonverbals to line up with our verbals, which actually isn't very easy to do and can lead to a lot of miscommunication.
Yeah, actually, so we're sitting across from one another right now doing this podcast, and I'm looking at you nodding your head as though anybody out there can actually see that.
Right.
Nodding my head. Did I say nodding your head? I'm nodding your head for you.
I was nodding my head.
But that is that implicit or that functional validation of just nodding, like, yes, I'm here with you. I'm hearing what you're saying. I'm agreeing with you. Just those nonverbals in and of themselves can be extremely validating. Yes. It's very different in someone saying, oh, yeah, I understand, as they're like scrolling through their cell phone. Mm-hmm. That doesn't match. That's going to make someone pretty irate. Right. There's also a kind of a argument, I think, about functional validation, like when someone is crying. Like if you're in a session and someone is crying, like kind of congruently, even handing them a tissue can be functional validation, or it can also be invalidating. So you kind of have to know who you're sitting across from. So if you offer a tissue to someone who hasn't asked for it and they're highly autonomous, they would not find that validating. Mm-hmm. But someone else who's actually just allowing themselves to experience pain for like the first time, you hand them a tissue and it can be very validating. Like, yes, it makes sense that you're upset.
I think in training we had heard that one of the supervisors we had was asking you to not give them a tissue because it might be communicating that it's not okay to cry.
Right.
So that was that. But I think for me, what I look for is like, have they looked for tissue, or are they needing one? Then I might do it. But if I don't see it, then we're just kind of status quo. They're crying, and that's okay.
I think my cutoff is when they start wiping their noses on their sleeves. Then I feel like functional validation of handing them a tissue is effective.
That's a good right. That's a good one.
Yeah, I'm not trying to move them out of sadness by handing them a tissue. I'm actually saying it's okay to cry when I hand them a tissue.
Right, and which is funny because that idea of handing a tissue then closes down sadness is not true, because that's really read in your body. Am I comfortable with seeing someone cry or being with someone they're crying? That is why people would continue to cry in your presence, is because you're okay with it and you're showing.
Yeah, I think that comes from the energy. Like, so I'm leaning forward and I'm there with them in the moment. I'm not like leaning back, grabbing the tissue box and tossing it at them. Mm-hmm. So a lot of it is more of their nonverbals yet again. So.
Like, hand the tissue box. Here, get your shit together.
Yeah, exactly.
It's just like, no.
Clean your face. Get out of here.
No, not at all.
No, it's like I'm with you in it.
Mm-hmm. Yeah. So we can kind of consider the purpose of validation. One is going between the phases of acceptance versus change. So to get to change, we got to start with acceptance. There's very few ways that are more powerful than validation to do that.
Mm-hmm. Well, and I think you actually need to do validation with change as well. So we validate to accept, but we also have to validate how hard it is to change. And I think that's a really important piece that gets missed a lot. So we validate how you feel, but we also have to be validating how hard it is to make these efforts to change, how hard I see you working. Mm-hmm. That keeps and reinforces the change.
Right, it creates a safe environment to be able to change.
Well, and then when you effectively validate people, they learn how to validate themselves. So if you grow up in an environment that isn't very good at or effective at validating, someone's emotional state or their behaviors, or when people are being effective. So a lot of times what happens is people get punished for being ineffective, but they don't get validated for being effective.
Right.
And so they don't really ever learn how to self-validate. And if you can't learn to self-validate, you can't really self-accept. And then you usually will end up in ineffective relationships.
Right. And also just validation within relationship going back and forth actually improves their interpersonal interactions. So we're communicating that we're listening and understanding each other. Also that we're non-judgmental, because validation and judgment really don't go hand in hand.
Right.
They're pretty counterthetical to each other. We're also, by validating, acknowledging what's true in the situation. And it's not really about proving who's right, but more about understanding each other's point of view.
And others are more receptive after we validate. So when we're trying to actually, change something in a relational dynamic, if we're able to validate someone, they're more open to being able to make the behavioral changes necessary to improve the relationship. So it's super important interpersonally.
Mm-hmm. It helps with repairing miscommunication too, because sometimes you can validate and then the other person if there's enough trust in a relationship, might say, that's not actually what I mean, or that's not where I'm coming from. And that's really very helpful, because validation, sometimes we think we know a perspective, and so we talk to it or speak to it and then realize like, oh, wait, that's not what I'm feeling, or that's not what's going on with me. And then I would ask, oh, can you please clarify? Tell me where I made the mistake or the error.
Well, then it helps to build trust too. So like I can tell you when you make an error, you can tell me when I make an error, because we know at the root of it all, there's a mutual understanding or a mutual respect.
Right.
And that there's also the agreement that we're both fallible.
Right.
And then I think it also helps maintain fairness and decreases anger. So again, that kind of goes back to like trying to prove who's right, who's not right. There's less of that and more of, even if we're in conflict, it's fair. We're not fighting dirty. There's no name calling. There's no attacking or assassinating the character. We can have disagreements about behaviors and disagreements about communication or misunderstandings, but they can be cleared up if there's mutual respect.
Right.
And that's only shown through validation.
I think also validation is helpful for rigidity, because like if you are in a conversation with somebody, kind of gets stuck in your point of view or your side, it's really hard to do that when you're empathically looking at someone else's perspective, like where are they coming from? How does it make sense where they're coming from? And really choosing to do that, it's very hard to stay like totally glued to your perspective. It is the way it is. This is the reality. Is working hard on validation helps you to set aside your own point of view enough so you can hold both point of views relatively equal.
Well, I like that you said enough, because we don't ever want to validate someone else's perspective to the point that we lose our own.
Right.
So it's like seeing things from someone else's perspective, working for that dialect, working for that middle ground, especially when we're talking about conflict.
Right. I think conflict is hard, because when we're in conflict, we become less accurate about our perspective, but also more like rigid and precise about it at the same time. So validation helps us from getting...
Good old emotion mind.
Oh, totally. So one of the difficulties I think people have with validating is that they misinterpret what it's actually doing or how it's actually functioning. So when you're validating, it doesn't mean, for one thing, it's not just like a general praise or general warmth or reinforcement. And reinforcement and validation are different. And to be kind of a wordsmith about this, I can be kind of nerdy about this, because sometimes people say, oh, isn't that validating? I'll be like, actually, that's not validating. That's actually positive reinforcement. That's different than validation. Validation also has to have with it an understanding of a perspective, which often, if it's done well, it's going to be positively reinforcing.
Right. However, if someone has a really significant shame narrative and then you validate them, they might actually find the validation aversive rather than reinforcing.
Right. So
I've had that happen.
Yes, it can happen. You have to always kind of be aware of that too, and be flexible.
That doesn't mean you stop validating, though. It
No.
means you shift your validation.
Right. You have to find a smaller piece, maybe. You have to shape your validation to where they're at. Also, validation doesn't mean that you're always agreeing with someone or agreeing in general. It's also not dishonest. Like,
yeah,
you
a
can't
lot of
lie.
people struggle with this one. If I validate someone else's perspective, well, I'm honest. I love that one when people say,
well, their honesty
I'm just
prevents
honest.
them. Their honesty prevents them from validating.
Right.
It's just like, wow.
I'm not going to blow smoke up your ass. Like, I'm honest. I'm going to call it as I see it. And I'm like, well, the way you see it is the problem. There's our issue.
Right. And the point is, you're not supposed to call it like you see it. You're supposed to call it like they see it.
Right.
So you have to find out what's going on in their story. It's not about
From their perspective.
You're not trying to convince them of yourself.
Right. So just because you can actually validate someone else's perspective doesn't mean that you're lying or changing your perspective.
Right. Because it has to make sense from their perspective, not your own. We also don't have to like what's valid.
No.
That's the thing. So I can validate something, a behavior, why someone does something, and not like the behavior whatsoever.
Well, we do that all the time with self-injury.
Yes.
So we're not saying, yeah, self-injury, thumbs up. We're saying it makes sense that self-injury works because your body releases opiates and it actually has a physiological response, and it's very reinforced, negatively reinforced by the emotional intensity decreasing. So it makes sense that this is your go-to.
Right. And I'll tell parents in a way that's not really tongue-in-cheek, but I'm serious. I'll say that self-injury is genius, pure genius. It works so well to reduce the physiological intensity. Like, what else are you going to do? Like, once you start down that pathway and you've been suffering for a long time, nothing else is going to make sense. Nothing else is going to be as powerful as that. So, of course, it just has to happen. And starting with that expectation or that understanding that that's how strong it is, that it has to be there. So you're not fighting with it being there. You just have to radically accept that it's there. It serves a powerful function, and it doesn't have to always be there.
Well, and there's so much shame around it. So
Right.
usually like their friends or their family, or why do you do that? You're such a beautiful girl. Why would you ruin your body like that? You know, I'm like, I don't know where people think that that's validating with the you're a beautiful girl part. I'm not really sure.
Well, I think it's the shame of like you're destroying your beauty by doing the behavior, is if you could choose to stop.
Right.
Like, oh, like you hadn't thought about that before. Like you hadn't thought, I have these wounds on my arm. People are going to notice this and think I'm weird or different. Or
Or when your parent
teens,
points out, well, wow, you're going to really have a hard time getting a job. You're like, yeah, thanks.
I think to me, like from my perspective, one of the worst ones is like, how are you going to look in your wedding dress?
Oh, yeah. Oof.
That I thought, I mean, the job thing is one thing, but I heard one parent one time talk about the wedding dress, and I was like, oh, that's super, super complicated.
Mm-hmm.
First of all, you know, you're maybe assuming that she's heterosexual and she might not be, you know,
Mm-hmm.
you're assuming that marriage is where you want to be, and that it's ultimately important how the physical beauty with, I mean, it's all these just complex messages intertwined and not helpful from the daughter's perspective.
I think another thing that gets really confusing, especially for parents or loved ones, maybe significant others, is thinking that validation is a lack of limits. So just
Right.
because I'm validating you, I'm supposed to let you be completely free to do whatever you want because I can't hold limits if I'm validating you. And that's actually even more invalidating. Like saying things that are validating and not having and holding any limits isn't actually validating. It's kind of fragilizing.
Well, sort of a light example might be if, say, your child came home late and missed their curfew, and you're having a conversation about the following day, and they were explaining, well, look, I knew what curfew was, I knew what time it was, and I didn't want to leave because all my friends were like wanting me to stay, and then I was going to be the first one to leave, and I thought that they would think I was like a sped or, you know, a weirdo for leaving early.
Sped. I don't think they do sped anymore.
Sped, that's out. That's out. Damn, I love that one.
Like in like 1990 maybe. But anyway.
But maybe the last time I've used it. So anyway, so they, you know, this fear, this social anxiety about being the first one to leave, that you could validate. Well, it makes sense. You'd feel anxious and you'd feel like an outsider, or that they might judge you because we have an earlier curfew. That makes sense. Yet
And
you know, and that's not saying that you know, the limits aren't going to be followed anymore, that you agree with them being home late. It's the understanding of it. It's really difficult to have an earlier curfew.
and validation is not lecturing. This
No.
is where I think people go tragically wrong. They validate, but then they lecture as to why the behavior isn't okay. So, it makes complete sense that you relapsed into self-injury because this was your coping mechanism, but they throw a but in there, blah, 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 and then go on and on for like a half an hour, and then the person's already completely checked out.
Yeah, you can easily undo your your validation can easily be undone. It's
Just
hard.
stick a but in there and you're good to go.
Yeah, if you talk too much, explain too much, go on too far, validating is hard, because when you're choosing to validate as a tool or a skill, the best are just like these really short statements, and then to leave it, but you have to leave it hang, and then that can feel kind of intense, and then we end up talking too much or adding extra things into the validation for our own tension in our body, but actually undoes the validation from another person's perspective.
Another thing validation is not, and this one's kind of tricky, validation is not the opposite of invalidation.
Right.
So I think that there are ways, like just because you're not calling someone names doesn't mean you're actually being validating.
Mm-hmm.
Or just because you're not going out of your way to be, rude to someone doesn't mean you're actually validating.
Right.
So I think that one's interesting. People just think, oh, it's the absence of invalidation.
No, they're invalidation is its own beast. I don't really feel like they're on the same continuum.
Well,
It's like there's no validation, and then there's validation, and then there's no invalidation, and then there's invalidation.
Yeah.
They're not on the same continuum for me, anyways. You also don't want to validate the invalid.
Mm-hmm.
So like that might be like a self-harm happening, validating the behavior. Like, well, it makes sense that you would do that. I would do that too, and it's okay that you do that. That's really not okay.
Mm-hmm.
And residents also know that.
Or like validating anger outbursts. Like I think people do this a lot, that venting energy.
Yeah.
Like, I know for a fact that if I am having an issue with my spouse and I have one friend that I can call up if I want to inflame my emotion mind, I can call that person, I can vent, and they're going to like totally validate my anger and my ineffectiveness. And they're going to be like, yeah, he's such a jerk. And they're going to just get right in it with me. That's actually not validating.
No.
If you care about me as a person, so if there's someone else in my life that, I want to talk about a difficulty with my spouse with, and someone who's a good friend and who's validating will say, yeah, it totally makes sense that you're angry. What are you going to do about it?
Right. Yeah, I think that's the thing. That's one of the bigger places I see this is the idea of catharsis.
Right.
So like this, which is a myth. Like the catharsis myth is if I have intense emotion, then I have to express and I have to act out emotion to make it better. But actually, catharsis backfires because if you act through your emotion, you amplify the emotion.
Right.
And so people often believe in catharsis with anger. You got to let your anger out. Actually, don't. Like back in the 70s, they used to have those little foam bats in family therapy, like kid to parent or whatever. And it was a safe space to do it. It's totally cool to do that. But then what you're doing is you're basically teaching someone that's okay to be aggressive, even if it's a foam bat.
Right.
And that kind of expression actually isn't effective.
Like being able to express anger effectively, so regulating the anger, because we talked about that in a previous podcast, how anger gets a bad rap. Like still be able to express the anger, but express it in a way that helps you move toward change rather than just beating the crap out of something. Like those over expressions of anger,
right?
Just perpetuated, or putting on all the sad songs when you're sad and just listening to all the sad songs and sobbing and sobbing and sobbing. It's not very validating.
So I can't just sit and listen to The Cure, the Disintegration album on repeat.
I mean, you can. It is a good album.
I did. And I believe that was when I had a minor depressive episode in college. I didn't see daylight for 2 weeks.
Blame it on The Cure.
Listened to The Cure the entire time and wrote a lot of really dark poetry.
And look where you are now.
Look where I am now.
See?
Not published. But I love Robert Smith.
Hey, you're probably not alone in that.
Yeah. So we can look for things to validate. So what do we validate? So I was trying to think of what you said earlier about that idea of kind of telling people you see it, proving your point of view. And sometimes it happens because people can't find what to validate because they want to make the other person realize they're seeing things the wrong way.
Right.
So I think we have to figure out then from that other person's perspective what's valid. So them trying to live to their values, following through with, that they're trying to act in accordance with their values.
Even if you don't agree with the value.
Right.
So that's the thing that's really important. I think that gets mixed up in family systems too. When, adolescents start to differentiate from their family and they start adopting their own values based on what their family has taught them, based on their social experiences, and their own cognitive styles and personality types.
Right.
They start to develop their own values. And a lot of the times, if those values differ from the family's values, which typically happens, which is why adolescence is so fun, parents have a hard time identifying or validating their kids' values because the values are different than the family values.
Right.
So, very Christian families, and then someone in the family, is gay, and then they come out. It's really hard for parents to be able to validate that, because it's so against the family value. Right.
I think, also the thing that is a lot of times very helpful to validate would be emotions. So if you can validate their emotional response, that's really helpful. It does get confusing because sometimes the emotion that's expressed may not be the actual congruent emotion. So that can sometimes backfire.
Well, you think about Duke, the story that you told about Duke. I mean, he didn't validate that she should be angry and that she should stay stuck in anger. He's just like, wow, you are pissed off.
Right.
That was accurate reflection of her current emotional state.
Completely.
And then by being able to see her and not tell her that she shouldn't be angry or she needs to calm down, wow, you're pissed. Let's go talk about it. Let's go figure it out. Then she probably was able to access, either a lower level of anger or, it could have been anxiety that was driving the anger. It could have been sadness. Who knows what the primary was.
Right.
But yeah, so you can validate the emotion, even if the emotion doesn't fit the facts because it's existing. It's there, it's present, it exists.
Right. Also, you can validate someone's motivation for putting in their effort. So even if they fail at a task, you can, clearly, this is a big one for me. If someone failed at a task but they tried hard, you got to validate the motivation.
Yeah.
How hard they worked towards something, even if they weren't successful.
Right. They strung together, maybe they're someone who chronically self-harms.
Right.
And there's no space in between the prompting event and the self-injury. And then a couple of weeks into treatment, they're frustrated because they're still self-harming. But now it's an hour between the prompting event and the self-injury, and they strung together a bunch of skills. The outcome is still the same. There's self-injury, but we can talk about the process and validate the process. You're like, God, that must have been so hard. You did this, 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 and this. Wow, that's progress.
Well, we had a resident one time where they were purging 2 or 3 times a day, which is also serves a function for self-injury, but they hadn't been engaging any kind of skin-based self-injury like cutting or anything. And then she had stopped purging for over half a week or something like that. And then had a self-harm episode on a Sunday after a difficult phone call, I thought it was.
Mm-hmm.
And then when we show up Monday, she was just like beside herself with like, when you kicked out the program, I'm a total failure. I'm not very successful. And I just kind of listened to like how many skills did she use before she self-harmed, which was like a lot. And so I validated like, man, you like skilled yourself totally. And in the end, you self-harmed. And like, I'm totally impressed by how much you skilled. And then I went one above that and said, and you haven't purged for like the last 5 days. Mm-hmm. That's amazing. And sometimes you have substance behaviors, but like you still hadn't purged for about half a week. And then you had the self-harm episode. Like you're actually kicking it out of the ballpark because you were self-harming every 2 or 3 days and you're purging every day. And now you're back to, you had no self-injury for basically like 5 days.
Mm-hmm.
That's incredible. And so I think that felt like a turning point for her to have that, just to not be shamed about it.
Right.
And it wasn't perfectionistic, but I was focused on like really the amount of something, and we're shaping a behavior, and also behaviors can change. Like the functions can be the same, but it could be different behavior. But her not being able to see within herself that all was lost in her mind.
Right.
And I'm like, do you have any idea how incredible that this last week has been for you? And then you just get back on the horse and keep doing what you're doing.
Well, and that's the strength of effective validation, because then because I know who you're talking about.
Mm-hmm.
And then she was able to validate herself and be like, wow, actually that is progress. So I think a lot of times people fail to see their own progress.
Right.
Because they're so black and white, like it's all or nothing. Like I said, I was going to, not engage in these behaviors and all is lost and I'm never going to get better. And then you hit them with that kind of validation. It helps them accept fallibility. It helps them accept that recovery is not linear. Mm-hmm. And it helps them with self-validation, which will reduce the significance of relapses in the future.
Right. And I think for me, what happens is in those moments is, when we haven't talked about these yet so much, but there are certain assumptions within DBT. Mm-hmm. And for what that does for me is one of the assumptions, like everybody's trying, everybody wants to improve. So I have this random self-injury over a weekend. Immediately I'm looking for, well, how is this an improvement? So as weird as that sounds, like she did self-harm, I'm still looking for, but is this still an improvement? That's entirely possible. And it was. Right away, you immediately, if you go back and look at the data, you're like, oh my God, this is still a total improvement for her.
Right.
Like she is, everyone wants to improve their lives, everyone wants to improve. Like, so that's the assumption. Then I look for the data. Does it also line up with that? And a lot of times it actually does, which I find very interesting. So how you can see the assumptions often follow in line with, how they're doing.
Right. And the other thing that you can validate is you can validate thoughts.
Yes.
And that can be dangerous, obviously, but really just labeling something as a thought is validating.
Right.
So I know a lot of times I'll have residents that'll say, I can't do this. I can't do it. I'm like, okay, so you're having the thought that you can't do it. Mm-hmm. Yes. And, so that doesn't mean you can't. That's not a fact, but you're having the thought that you can't, or you're having the thought that so-and-so doesn't like you, or so just being able to label the thoughts as thoughts, and you can validate, those are thoughts. They're things that are actually happening in your mind right now that, we may or may not agree with, we may or may not need to challenge, but they exist.
That's very true.
And then we can also, of course, validate the facts of a situation.
Mm-hmm.
Whatever is observable, we can validate.
Right. We can validate behaviors, which I think is helpful too, because sometimes the behaviors aren't target behaviors, so to speak. Mm-hmm. Sometimes you have a person their behavior is actually pretty effective, actually so effective that they end up getting rejected by the other person.
Yeah, sometimes by their own parent.
Yeah.
As girls get a little bit further along in treatment and they're effective, and then the parent hasn't shifted or changed or hasn't recognized how much that the resident has shifted and changed. Sometimes they get punished for being effective.
Oh, I just had talked with a resident who was on an inpatient unit, and it's a unit that does they do it like a DBT group, right? So they're trying to talk the talk and walk the walk, which is very hard to do for your listeners out there, to be honest. It takes a lot of training.
Especially at higher levels of care.
And a lot of practice to do this work. And she had gotten overwhelmed because of responses likely from the clinician were actually invalidating. Mm-hmm. So she got, physiologically aroused and then asked to leave the session, which the clinician said, yes, you can. So she went and said she was going to be gone for 5 minutes, but she went and talked to a nurse, I guess, at this real quick for 3 minutes, did some breathing, and actually came back after 3 minutes and then came back into the room. And then the clinician then told her that, we don't take breaks here. So, how confusing, right?
What a double bind.
She asked to take a break, which is totally appropriate, right? And then the reinforcer is, yes, you can take a break. That's wonderful. And then she takes a break, gets regulated, and then comes back to have the conversation. It's hard to come back.
And then gets punished.
It's super hard to come back once you're just regulated. So she comes back. This is great. Everything's great. And the response is, we don't take breaks here. So punished for taking a break, but you're also told you could take a break and then get punished for it. So basically she's effective and gets punished.
Right.
So what I
by
would,
a clinician.
Right. And what I would hope to do in that respect is if someone came back, I'm pretty clear that I'm comment on that. Well, thank you for coming back. It's nice to see that you used some skills and came back.
Mm-hmm.
I comment on the fact that they came back. It's not an assumed thing.
Mm-hmm.
If anyone has to leave a room, my assumption is maybe they can't regulate and come back. It's really difficult to do. And when they do it, that's remarkable.
Yeah, no, I agree. So then I guess the next question is, when do you validate? Or for me, the answer is pretty much whenever.
Whenever you think
whenever.
of it, or whenever it happens.
I mean, I feel like if people validated more effectively, now, not like, it's not cheerleading. I think that's a really important thing. Validating is not cheerleading. It's not like, oh, you're so awesome, you're so amazing, you can do anything you put your mind to. That's not validation.
It's not. Validation doesn't lead.
Right.
That's my I feel about validation. You're not leading anyone anywhere. You're basically kind of lining up with them. Like, we're here together.
In this current moment in time.
Yeah. I have nowhere to go. I don't have a direction. We're here, and you might have just told me some really hard information, and I'm going to validate that. I'm going to sit with you in this. Mm-hmm. This is where I'm at. It's that energy. It's a very open yet non-moving kind of. I feel like it's like kind of like water. Just kind of fills in the spaces.
Fills in the gaps in the spaces.
And kind of stays there and doesn't have to go anywhere, and it just kind of fits.
Yeah, I like that idea. I like that visual. So then there's some emotional validation strategies. And we're going to get into this a little bit more when we talk about the 6 levels of validation, but just in general, reading emotions is one emotional validation strategy. So communicating understanding of normal emotional reactions. Mm-hmm. A lot of people, depending on their lived situation, they could have completely adaptive, normal emotional responses to cues in the environment. But because other people can't tolerate negative emotion, they try to move them out of that emotion. So they learn that their normal adaptive responses are not socially acceptable. Right. So a little kid crying when they get hurt, like you see that on the playground all the time. I remember when I was a stay-at-home mom and we'd go to the playground, I would always look to see how people responded when their kids like fell off of playground equipment. You might have the one parent that like rushes in, they're, like, oh my God, are you okay? And the kid was totally fine until the mom has a really big emotional response.
Right.
And the kid's like, bah! And like totally freaks out. Or the kid falls, hurts himself, cries, and then you have the mom that comes up and you're like, oh, brush it off, you're fine, go play. Mm-hmm. So completely dismissive. And then, you have the mom that might just look, observe, see what the kid does, let the kid respond first, and then responds to their response. Mm-hmm. Just like, yeah, it makes sense. It hurt. Do we need a Band-Aid? Give them a little hug, and then poof, they're off and playing. That was validating an effective emotional response.
I think that's a good example, because I think what happens when kids are little is like you'll see little 2-year-olds like running and then just wipe out and they hit, and then the world kind of stops for them. Yeah. And then they arch their back and they typically look up.
They look to see what the environment's going to say or do.
Unless it's super painful, they'll start crying. But like they do this kind of thing. It's like shocking. I fell down and look up. And then they're usually looking for their primary attachment figure, which is typically mom. Mm-hmm. So like look up and they're looking. And I think what they're doing is they're reading your face. Right. Like, how am I supposed to take this? Because this was abrupt. Something happened. I don't know if I don't think I like this, but how bad? And they look to you. And then if you're dismissive, the issue with that is like they might not cry, but they might feel like it's not okay to cry. If you're anxious on your face, they'll just burst into tears. Totally. It's just more of the validations, the middle road where it's like, oh, that must have hurt. Mm-hmm. And here, let me help you up and we'll dust you off. But you comment on the fact that it would be okay that it hurt. Mm-hmm. It makes sense that it hurt. Right, and then dust it off. So it's so to be dismissive is not entirely the best place to be at, but that idea of like, yeah, that must have hurt and it's okay. We get hurt sometimes.
Yep, and not over-responding to it.
Right.
And another emotional validation strategy is to teach emotional mindfulness. So provide prompts for observing, describing, and labeling emotions. So that's basically what you just described, but with like a physical thing. Right. I know for me, both of my girls, I think 6th grade is brutal because they go from elementary school, everything seems so simple. And the social hierarchies aren't exactly terrible yet. And, everybody's been friends. If they've lived in the same community, they've been friends since 3K. And, and they're in these smaller schools, but then they all filter together into middle school and all of these social dynamics change. And I don't know, I think it's worse for girls in 6th grade than it is for boys, but I'm not entirely sure because I've never raised boys.
I would back that up, and I have my own theories on that.
I bet you do.
Yeah.
Which are probably pretty spot on. But I think, so both of my girls experienced a lot, like losses of relationship with people that they'd been friends with since they were 3 years old. And it happened in 6th grade, and it was really devastating.
Yeah.
And I remember being able to, with my older daughter, obviously I wasn't quite as adept at, my own personal mindfulness. I had urges to be like, well, so-and-so's a B anyway, so who really cares? You're better than that, blah, blah, blah. So I had all these urges to like want the negative emotion to go away. I was angry at the other girl who's basically having a normative, adolescence, right? Like differentiating, figuring themselves out, assessing their relationships. But with my second daughter, I was more aware. I was more mindful myself. Obviously aware of all of this. I was able to say, it makes sense. You've known this person since you were 3. You guys have been best friends. You did everything together, and it makes sense that you'd be sad. You look sad. It makes sense that you'd be sad. It hurts,
Right.
when a relationship changes. So basically teaching her the emotional mindfulness cues, and then assist in differentiating the event from the assumptions. So initially she had a lot of assumptions about her friend, like, she's a popular. She's a popular. And, she doesn't like me anymore. And I was like, well, that could be an assumption. I mean, do you know she doesn't like you? Like, yes, factually, she's not spending as much time with you. Factually, she's spending more time with these other girls. But the rest of that is just all assumptions. And so helping her to be able to differentiate the facts of the situation from the assumptions was really helpful, while still validating that it's sad that there's been such a change in the relationship.
Right. And also with validation, one of the things we'd like to try to do, or which is helpful, is you're trying to communicate the validity of someone's perspective. So we want to try to provide normative validation when possible. So trying to communicate that your response is normal, whatever part of that you can claim is normal based on, and we'll talk a little bit about this in levels of validation, but is it normal to their lived experience, or is it normal to them just being a human being? The more normal something can be, the more helpful that's going to be within validation.
It makes sense that you're sad when your relationships change.
Right. Absolutely.
It's hard. And then validation leads to disclosure. And what I've noticed with both of my girls is the more accurate my validation is, the more they're willing to disclose to me. So if I'm not, doing well with validation, or I guess by contrast, my husband is not someone who's naturally validating. He's an awesome provider. He loves to coach and instruct and train. But validation, I think, is not a concept that like he was really raised with or something he was really exposed to. So it's harder for him to be able to validate when either one of the girls are struggling. Also, they're idealists and he's a guardian. So like there's a lot of difference there too. Yeah,
there's sensitivity that the idealist has that guardians may not have as much for the validation.
Right. And so for him, like, and also I think it's also painful for him to see his girls in pain. So he wants to move them out of it quickly. And I know that they have a more difficult time disclosing to him, and it's not just a gender difference.
Right.
He's been working on his validation, and I know that my older daughter feels more comfortable now telling him things because she doesn't feel as though he's going to try to move her out of the emotion. So their relationship has improved pretty significantly with his ability to validate her.
And I think we had talked briefly earlier about validation and with regards to how I view it as you're stepping in there with a person, but you're not going in a particular direction. And this reminds me of the dimensions of relationships we often talk about. At some point in the podcast, we'll talk about it. But validation is like this mix of like connection with like love and connectedness, while at the same time the goal is for the other person to be free to their experience.
Right.
You're not trying to control them. You're not trying to take them anywhere. It's not really neutral. It's really like allowing them to be free in their emotional response, but you're staying connected to them in their response. So it's a lot like walking alongside somebody, where they're walking, what they're doing. I laugh at my friend Hunter. He's very funny. He's very sarcastic, and he likes, shocking humor. But he used to joke about how annoyed he was with his daughter when she was little. She was like 2.5 and 3. And like they were walking around outside in New Hampshire, and like she was like picking up every single leaf, like every tidbit of anything on the sidewalk. She'd pick it up and just look at it in amazement and wonder. And Hunter's like, Jesus, it's taking forever. Oh my God. Like he gets so impatient. He's so honest about his emotions. But geez, he'd be like, Grace, stop. It's like, it's not that great. Like, what are you doing? You're killing me.
It's one of a bazillion leaves.
Yeah, so it's really funny. So internally his experience is like, oh my God, she's learning the world. It's so hard to watch this happen. It's taking forever. But I think interpersonally, father and daughter, he's really supporting her and being very patient. But internally he's just like, oh my God, it's another leaf. They're all the same.
Sometimes we can't let our internal dialogue leak out.
Absolutely. So I think we'll probably end this here for now, but we do want to have a chance to talk about the levels of validation because those are also very important. And this has been All Therapists Are Jerks with Ulland
and Jo.
Thank you for listening.